All right. Good afternoon. Hello. Thank you for joining us today on GSU's Thought Leadership Interview Series. I'm Michelle Sabasco, Director of GSU's School of Extended Learning Academic Partnerships. And today we're interviewing Professor Natalia Rekhter from GSU's Health Administration Department. Hello and welcome. Thank you for being here.
Hello, thank you for having me. I'm very excited.
So could you please begin with just giving us a little bit about yourself? Who are you, Professor Rekhter?
Hi, my name is Natalia Rekhter. You can hear I speak with an accent. I am originally from Russia. I've been here for a long time, but my accent stays. It will never go away. So don't hope it will go away. And briefly, I did my master's in health administration at the University of Michigan, did my PhD in higher education at the Indiana University Bloomington, and I've been with GSU for 4 years. I'm an assistant professor. I'm also a director of the undergraduate health administration program.
Thank you so much. And would you be able to share a little bit more about your program at GSU, the Bachelor of Health Administration program?
Absolutely. Many people don't even know about what health administration program is. When I ask people about any type of healthcare field, they always respond with answers like, oh, it's about nursing, it's about doctors, it's about therapists, and it's all true. But my next question is always, who do you think help doctors, nurses, therapists run their businesses and provide care to patients? And that's what health administrators do. We are behind the scenes. We are the heart of the health administration, of the health administration business. We help with insurance, we help with billing, we help with marketing services, we help with reaching out to patients, we help with credentialing physicians. We do a lot of different things, and without those things, healthcare will not be able to function.
Oh, that makes sense. Thank you for that excellent picture of the program. Can you talk to us a little bit about what kind of classes that students will be taking when they enter the program?
Thank you for asking this, because that's very important to understand what we're studying. And because we are running the business of healthcare, a lot of our classes are business classes. Our students have to take accounting, they have to take planning, they have to take strategic planning, but at the same time, they also take classes with more clinical aspect, like for instance, epidemiology, because we want them to know about the population and population healthcare services. They also take classes like healthcare ethics, because it's a very unique, everybody has to take ethics, but it's related to healthcare. They take classes like medical insurance and reimbursement. You know, that's how healthcare is being paid for, and it's really important for students to understand how Medicaid is different from Medicare, about private insurance, how this insurance reimburses different types of patients, veteran insurance, etc. So they take a combination of business classes and healthcare industry classes to be able to focus on improving and helping healthcare industry and healthcare professionals.
That's a lot to consider. I hadn't thought about all that. So tell us about what interesting trend or trends that you have observed within the industry. I mean, especially given, you know, what we're facing right now with the pandemic.
That's a whatever $60 million question. But if we think about trends, something that our students hear almost every single day: population is aging. And because population is aging, they require, this population group requires certain type of services and more services. It actually drives the need for healthcare services because of the population aging and the amount of services requested. So that's one of the trends. We see more services needed. We see different types of services. We see development of different types of long-term care facilities. The old idea about nursing homes not working anymore. We see continuous care facilities. We see home health care, adult daycare, and all of those new and not so new trends in healthcare. Another trend is the movement from the hospital care to outpatient. Because when you think about healthcare, the first thing that comes to mind, a hospital. But we are now focused on preventive services. We don't want patients to get sick. We want them to take care of themselves before they get sick. We want them to go to doctors and go through annual checkups. And that's one thing. And another thing, technology is allowing patients to go through services outpatiently without being hospitalized. So they can recover faster, they can go home faster, and it's less expensive. So that's another trend. And I can go on and on. So I'll save you some time. Thank you for asking me.
No, healthcare is changing every day, and you know, you get emails every day about healthcare education and stuff like that. So with that being said, and talking about all those trends, can you tell us, in your professional opinion, what does health administration look like in terms of job prospects and opportunities in a year, in 5 years, in 10 years? What are graduates, where are they gonna work?
The prospects are very positive. And first, because of this magic wars, population is aging. There are going to be many, many jobs in long-term care industry. If anybody is interested to check out U.S. Department of Labor, they will see fantastic statistics about it. But I can give you just one little example. The need for health administration jobs in long-term care today is satisfied at the level of about 38%. So it's a huge market where our students can find jobs. Another good, and that's kind of just one segment. In a larger scale, our graduates, the job market, the healthcare job market is growing faster than any other industry, and so are the salaries in this market. So if anybody wants to spend some time to look into it, you will be surprised, positively surprised, at how many jobs in healthcare administration are available right now, and that it's a pretty well-paid field. And I was mentioning like outpatient facilities. That's where many of our graduates work, in addition to hospitals, running maybe physician practices, not starting as directors, but helping to run physician practices and moving up the career ladder, working in some different types of outpatient facilities. So there are lots of opportunities. Sorry for interrupting.
Oh, that's okay. You do definitely see, when you search the U.S. labor statistics or just a job board, if you just pay attention to a job board, it's all healthcare, health administration, nursing. So, you know, I can't see that going away, especially with, as you said, the population aging. It's also really good to know, you know, what are the students doing? What are Governor State University students doing? Where are they working? That we want to know, you know, are they in hospital settings nearby? Can you tell us some of that?
Absolutely. We have students who work in the Illinois State Department of Health and Human Services. We have a couple of students there right now. One of them is a consultant, another one is a surveillance specialist. We have students who work in the Cook County Health Department. So those are the government jobs. We have students who work in local healthcare organizations and hospitals. In Advocate Healthcare System, we have students who work in Northwestern Hospital, and some of them are in a managerial role, like running. One of them is a manager for credentialing, another one is associate manager for credentialing. We have students who manage imaging department in Northwestern Hospital. We have several students who work in different capacities in Blue Cross Blue Shield, in Cigna, Some of them are patient advocates, some of them are underwriters, so working with billing and insurance. We have large group of students who run different types of physician practices, solo practice, multi-practice group, multi-specialty practice, etc. So many different organizations. I have a student who works for the Department of Education, developing educational programs for schools about obesity prevention, COVID awareness, healthy eating, healthy habits, health administration student.
So many opportunities, and it sounds
That's
like you've
right.
got more to share too.
Mhm.
But we'll leave that so that students can contact me to find out about more opportunities. Let's see, the next question we have is, why should students choose GSU's Health Administration program?
Um, It's a great program. First of all, it's accredited by Association of University Programs in Health Administration. We have a 6-year accreditation, which is great. It's the best. So it's one of the accredited programs in the state of Illinois. It also allows students a lot of flexibility. They can take classes. Some of the classes are online, not the entire program, but some classes are online. Some classes are offered in a hybrid format when students take some weeks they're doing everything at home and some weeks they have to come on campus. And there is also an opportunity for face-to-face interactions with professors. We also have a robust practicum program. All the organizations are approved and have affiliations with the university, and we place students. Students don't have to find their own practicum. We find the practicum placement for them and place them there, and they gain 3 to 4 months of supervised experience, and they can use it in their resume, and they can use these connections as references. So it's great. And
That's
they have wonderful
fantastic.
faculty, very knowledgeable.
That is fantastic. A lot of times you don't hear that programs are placing students for practicum opportunities, that they have to find it themselves. So that is a wonderful, wonderful opportunity. I will add that another reason to transfer to GSU's Bachelor's of Health Administration is that, you know, we will accept programming from both an Associate of Science or an Associate of Applied Science in health-related programs. And what you're looking at when you transfer over is about 54 credit hours for the Health Administration Upper Division portion of the program. We're also very generous in the fact that, you know, you've got to have a 2.5 GPA on a 4.0 scale in order to be admitted, so that's pretty generous. I will also mention here really quickly is that we are recruiting right now for the cohort that's going to be established at Kankakee Community College in Bradley for fall of 2021. So we will be establishing a brand new health administration cohort on that site. Your application does need to be in by June 15th. And the last thing I want to just kind of find out a little bit more about you, Professor, is how about share a fun and interesting fact about yourself?
I love travel. I'm very interested actually in learning about healthcare delivery in other countries. And I've visited, I may be a little bit mistaken, but I believe I already visited 36 countries. And if I have a chance, I try to visit healthcare, either hospital or an physician office there just for fun, not because I'm sick, just for fun to see how it'll look like. If my time allows me, if my agenda allows me, I always try to do it because I'm very interested how healthcare is delivered in countries outside of the United States.
That's so awesome. And I can't imagine the value that a well-traveled professor brings to the classroom. So just a couple more tidbits. Our tuition is $313 per credit hour. We can transfer up to 80 hours. We have several different scholarship opportunities. And if this program interested you in any way, shape, or form, please reach out to me. My name is Michelle. You may also reach out directly to Professor Rekhter if you'd like. But you can reach out to me. Here's my contact information. I can be reached at msabasco@govst.edu or 708-235-3983. And Professor Rekhter, I really want to thank you for your time. This has been super informative. And we thank you. Thank you so much.
Thank you for having me. That was a lot of fun. And like Michelle said, if anybody has any questions, she would direct for me. She can direct you, and you can find me at GSU.
Absolutely. Thank you so much.
Thank you.